COVID-19 vaccines are in high demand, but supplies are limited. On this episode, find out how individuals are being prioritized based on jobs, risk factors, and more.
Whether you live in or just love Johnson County, Kansas, JoCo on the Go has everything Johnson County. Here's what's happening and what's coming up in the community you call home.
Thanks for joining us for JoCo on the Go. I'm your host, Teresa Freed, a Johnson County resident and employee of Johnson County government. Johnson County is following the state's COVID-19 vaccination plan, starting with healthcare workers, including EMS staff, and long-term care facilities are also receiving vaccines. Here to tell us the latest on the vaccine rollout is Johnson County Department of Health and Environment Director, Dr. Sanmi Areola. Thanks for being here today.
Thanks for having me, Teresa.
All right. Well, first off, just wanted to quickly follow up with you about your vaccination. Are you still feeling good? And when do you get your booster?
I got my first dose 2 weeks ago today. I feel fantastic. When I got it, I had a little bit of soreness on the point of injection and a little bit very mild fever for a couple of days. Obviously, your body recognizing the foreign material and producing antibodies in response to that. That's precisely what we want. I feel fantastic. I should be getting my second dose in a couple of weeks. Looking forward to that. I'm looking forward to feeling protected and being really excited that we're getting to vaccinate some of our residents.
And what have you seen as far as response from the people who are getting vaccinated? Is it a similar experience where people are feeling excited or relieved?
The response has been fantastic. I've spoken with so many people that have gotten the Pfizer vaccine, people that have gotten the Moderna vaccine, our staff, other healthcare providers, EMS staff. I've really had the same response. I've had contact with other people in other states, in other places that have taken the vaccine, and the feedback has been pretty consistent. It's there are most people no reactions. If there are any, they're very mild, not unlike you would when you take a flu vaccine. People are very excited about that, and by far my biggest things that I've liked coming from people is the desire to take the vaccine. I know that we're reading nationally that maybe 60+% of people wants to take it. That's different from what we are seeing here. We are getting a lot of interest. Getting interest from our teachers, from our school nurses, interest from people that are in their homes with underlying conditions, people that are older than 65 and 70, people that are in long-term care facilities. So much positive responses from people. The limiting factor right now is getting the vaccine so we can vaccinate people. The vaccine, we need to get them here. We need to get them into people's arms as quickly as we can. And the limiting factor is not for lack of uptake. It is the vaccine themselves, and that's what we're working on.
All right. So the enthusiasm is, I'm sure, just overwhelming to the point where it's maybe a little frustrating that people can't get the vaccine right away when they want it. So can you talk about the latest on the rollout plan, especially here in Johnson County?
Right, and that's thank you for the excellent question. It's and so I think it gives me an opportunity to let people know where we are, what we have received, and moving forward, what our plans are. There are multiple approaches to the distribution of the vaccine. There is the vaccine that's going directly to long-term care facilities, skilled nursing homes, that through what we call the Federal Pharmacy Partnership, that's working through CVS and Walgreens with these institutions. There are vaccines that are going directly to our hospitals and big health systems, and they're vaccinating their healthcare workers. There are some that are going to our federally qualified health centers, the so-called FQHCs, and there are very few that are coming to us. Thus far, we've had 1,200 doses. And those were really earmarked for public health workers as well as EMS personnel. and we quickly deployed those and vaccinated as many people as we possibly can. And then the few remaining doses, we started vaccinating our other healthcare workers. But then really proud of the partnership that we have with Health Partnership, our FQHCs here, who received a few doses. And they have worked with us to distribute 2,800 of the doses that they received. And we are opening up vaccination clinics tomorrow and Wednesday to vaccinate about 2,800 people. A couple of things to keep in mind. We have plans in place where we can literally vaccinate thousands of people every day. We can open up multiple locations, we'll staff them and we'll vaccinate them. It's been very impressive that there are so many local organizations, health systems who are reaching out to us to assist if we need help. So we probably can expand on those plans that we've had. We can open up locations across the county. But again, the key point is getting the vaccine. I've also been so impressed by the number of providers, number of individuals that are reaching out to us wanting to get vaccinated. And so we did send out the survey a few weeks ago asking providers, a dentist, ophthalmologist, phlebotomist, all of those different people groups that are in Group 1A to register, and about 25,000 requests for vaccination have been received thus far in there. So what we are doing with that list is going down the list and inviting those people to register and reserve one of those slots for tomorrow and Wednesday to receive their vaccine. Again, very limited number of doses available. But as we get more doses, we will be pushing those out. It's also very important for people to understand that right now we are in Group 1A, Group 1, the first group, where we are vaccinating healthcare workers and residents and staff on long-term care facilities. The second group will come after we have finished this group. That second group is big. It includes people that are 75 years or older. It includes educators. It includes our essential workers, which is of very, very high importance to me and to us. These are our residents who are in the forefront when we close everything down. They're the ones that work in our schools. They work in our grocery stores. They're just right up there, and the risk is pretty high. And so we're looking forward to getting to that. I know that I've been asked, when will that start? The limiting factor again for us is availability of vaccine. If we get 20,000 vaccines today, I can assure you that we'll give those out very quickly. And once we finish the first group of the healthcare workers, we'll be ready to roll on to the next group. We are working with the state, KDHA. I understand that, look, we are one of several counties and several entities that they're dealing with. They're also dealing with supply issues with the vaccines coming from the feds. But I know that everyone is working hard for us to get the vaccines here so we can get the vaccines into the arms of the people. The only way that we reach herd immunity is not simply the availability of the vaccine, it's getting people vaccinated, and that remains our goal.
And I know people often wonder, just why don't we have the vaccine already mass produced so everyone can get vaccinated? What does the production process look like? Why does this take time?
Well, so here's what we know, that this was done pretty quickly. And whereas the technique, at least for the ones we have on the market, the messenger RNA has been worked on for several years trying to perfect that. This is the first time that is being deployed. And one of the advantages was we can produce this quickly. And I think the original plan was to have 20 million of those doses distributed by the end of last year. We didn't quite meet that. But from what we are reading and hearing and the updates is between Pfizer, BioNTech, and Moderna, and upcoming approvals that we think will come, AstraZeneca and others, we should have a lot more doses coming in the next few months, perhaps next few weeks. But for us at the local level, it takes a while to get here. This is where the rubber meets the road, like they say. This is where we actually give the vaccine out. And we're really providing feedback to people at the state to let them know that we're ready. We do need the vaccine, but where we get the vaccine is really out of our control here. When we get it, we're ready to give them out, and our goal is to give them out as quickly as we can.
And can you talk a little bit more about how the groups are prioritized? So obviously those healthcare frontline workers, it's important to ensure that we have a strong health system medical system that can meet the needs of patients. So that's obviously a high priority. Why are these other groups in the tiers that they're in?
Yeah, well, so the primary prioritization was done by the CDC Vaccine Advisory Group. And as you can tell, this is not very easy making a distinction between groups that need the vaccine, but it's got to be done somehow. Healthcare workers are important, again, easy to understand because a part of our concern with increased cases is increased hospitalization and death. And we need our healthcare workers who are seeing patients to be there, so our capacity there is maintained and not adversely impacted. That doesn't make other people less important. We also know that some of the more serious consequences we have found in our long-term care facilities are older population who tend to have one or more underlying conditions. So it goes without saying that we need to protect those populations. That's why they're in the first group. But that's also a very broad group. We have our nurses there, we have our EMS there, we have our nursing assistants, we have our physicians there, we have our therapists there, phlebotomists, pharmacists. All of those groups that are providing medical services to the community are included in that group. But the very next group is also very, very important. Like I said, it includes essential services workers. These are people that have been out there and they're providing services to the community. It includes our first responders. It includes law enforcement. It includes corrections, which again, there are conversations even within the state as to maybe that can be moved up. It does include our firefighters. It includes food and agricultural workers, USPS workers, our educators. And so you can see the pattern. It's people that are out there. And it includes people that are 75 years or older. And the very next group, which is the third group, includes people that are 65 years or older. And then some of the ones that we have not covered in group 2. And so again, it's really a way of spreading this out, understanding that not only do we need time to produce enough vaccine, but we also need resources to administer the vaccine. I'm getting a lot of questions, a lot of calls, a lot of anxiety from people saying, when will I get this, when will I not? Please understand that we want to get this into the arms of as many people as possible. For us to get to herd immunity, which we need, we think we need anywhere from 60% to 90% of us vaccinated. So we want you to get it. It's just working through that process. Again, if you work in transportation, logistics, water, wastewater, food service, shelter, housing, you will be in the third group. And again, you will see that these are still essential workers, not that different from the second group. It's just a way of prioritizing those. And the rest of us without underlying conditions who are younger, it may be a few months before you get it. But we're working very hard. Our limiting factor now is availability of vaccine. When we get the vaccine, we'll do our best to get it into people's arms as quickly as possible.
And any idea at this point when you might move into the next phase?
If we get the vaccines, I do want to reiterate that thus far, directly, we've gotten 1,200 doses. through our FQHC, we got additional 2,800. Again, I do know that the FQHC are also helping in vaccinating healthcare workers. So that's ongoing. If the vaccines were available and it's not a limiting factor, we will be done in a matter of days. The limiting factor is when do we get that? If we get the vaccines, we will give them out very quickly. So it's tough to predict until we get the vaccine. And again, we're in touch with the KDHE at this stage. I do know that they're working very hard. Obviously, they are distributing to a lot more places, several places. So logistically, it's a big challenge that they're having to deal with. And I get that question regularly. Tough for me to answer that until I know that I have enough vaccine to give. If we have the vaccine, it will be done in a matter of days. And so, again, as we get more information, as we get the vaccines, we'll be pushing out those information to our residents, so you know when it will be your turn to get the vaccine. Here's what we have been doing. We're going down the list of the providers that are registered with us, and we're vaccinating them. We'll vaccinate a lot more tomorrow. We'll vaccinate a lot more on Wednesday. And as we get more vaccine, we'll be moving very quickly through that list until we've taken care of those in our group 1. Keep in mind that as we are vaccinating healthcare workers, hospitals are doing the same thing for their staff. And through the Federal Pharmacy Partnership, the CVS and Walgreens are helping vaccinate residents of our long-term care facilities. So we could be done with that in a few weeks if we get vaccines to finish that.
And just to be clear, I know that the vaccine is so limited, but those who have gotten the initial vaccine will still get their vaccine booster on time. Is that right?
That is accurate. That has been made very clear by the state, is that we should start giving from our own vaccine, Moderna, which we started giving 2 weeks ago. In a couple of weeks, we should receive vaccines to start giving to people for their second dose. So what we're saying is does not impact the second dose that people are going to receive. It's really getting the first dose into the arms of as many people as possible. But it's not a concern. We expect people to get their second doses on time.
Okay. And, I ask this question often, but is there anyone who should not get this vaccine, or is it really something that everybody should get?
Well, so there are the vaccines are not approved for younger people. I believe the Moderna vaccine is approved for people older than 18, and the Pfizer vaccine approved for people older than 16. Because it's currently being tested on younger children. It's also being tested on pregnant women and lactating women. It doesn't mean that it's not safe, it just means that we don't have enough data. All of those have been tested. Keep in mind that what we have is an emergency use authorization, having been tested in thousands of people, and to ensure and assure its efficacy and safety. It was deemed that the benefits outweigh the risk, and so we have an emergency use authorization. But those original studies are still ongoing. And once they're completed, we'll have more information. So right now, it's if you are younger than 16 or 18, you are not eligible. If you are pregnant, we always say consult with your primary care physician. That shouldn't stop you from taking it, but it's always good to consult with your physician. If you have severe allergy, again, consult with your physician. We have processes in place to observe people for minutes after to take the vaccine, and if there are allergic reactions, we have processes in place to address those as quickly as we can.
All right, just last question. How will people know when it's their turn? Should they sign up somewhere, or how do they get the information?
Yeah, the only people that we've asked to sign up right now are medical providers who qualify in Group 1. All of the information will be available through our website, jocogov.org/coronavirus. We will be providing those information. Remember, these are in phases. There are groups that are being prioritized. We will do our best to let people know when we're moving from one phase to another. Right now, we're vaccinating the first group. Those are healthcare workers and residents of long-term care facilities. When we feel comfortable that we are about done with that and it will be time to move to the next phase, we'll be providing those information, but those information will be we'll push those out through different media as much as possible.
It's great information. All right. Thank you for being with us today.
Thank you, Teresa, for having me. Thank you.
All right. And thanks for listening.
You just heard JoCo on the Go. Join us next time for more Everything Johnson County. Have a topic you want to discuss? We want to hear from you. Follow us on Facebook and Twitter at JoCoGov. For more on this podcast, visit jocogov.org/podcast. Thanks for listening.